Hi guys. So there has been a recent breakthrough in cancer research or a cancer drug, and that beautiful drug is Daraxonrasib. So as we can see, RAS word is coming. So it is a drug which inhibit RAS mutated cancers, and especially it has been approved for pancreatic cancer. So I'm Dr. Ankit. Let's talk about this drug in great detail, that why it's a major breakthrough for the cancer chemotherapy. So pancreatic cancer, remember 90% of the cancers are pancreatic ductal adenocarcinoma, and they have a very poor survival rate. Less than 15% of the people, they live till 6 months of the age. Now why is it so? Because most of the pancreatic cancers, they are radio resistant. Chemotherapy has a very less efficacy. Plus we can't do surgery because we know that pancreatic is a retroperitoneal organ. So if a patient of pancreatic ductal adenocarcinoma comes, 90% of the patients, they suffer from a single KRAS mutation. So what is this KRAS? That we will be discussing, but let's talk about a beautiful drug, Daraxonrasib. So Daraxonrasib, it inhibits RAS pathway. Now the good thing about this drug is it works when the RAS pathway is overactive, which is causing cancer. So this is a RAS-on inhibitor, and we know that in a cancer the RAS pathway will be overactive, so it selectively targets cancerous cells, and that is why it is a very efficacious drug, recently got approved. So it got a major breakthrough therapy approval in US FDA. So what about this RAS? Understand that RAS is a group of proto-oncogene. That means they are responsible for cell division, and RAS proto-oncogene has various subtypes of gene like KRAS, HRAS and NRAS. So KRAS, just focus on KRAS. It is a type of proto-oncogene among RAS family. Now this KRAS is a very integral part of a receptor known as tyrosine kinase receptor. This tyrosine kinase receptor responds to growth factors. When growth factors act on tyrosine kinase receptor, it causes cell division through RAS pathway or KRAS pathway. Now to work, KRAS need active form of GTP. So when GTP binds to KRAS protein, it leads to signal transduction. And remember, RAS pathway will lead to activation of RAF pathway and PIK3 pathway. So for a moment, remember, KRAS leads to RAF and PIK3 stimulation, and this leads to signal transduction inside the cell, which will lead to cell differentiation or cell division. Now remember, in a normal healthy cell, this RAS or KRAS, remember, they work in a very regulated manner. That means they work in a very controlled manner, which will lead to normal cell division. But what happens if there is some mutation in KRAS gene? This KRAS protein becomes overactive, there is gain of function, and this leads to mutated proto-oncogene KRAS. It leads to excessive cell division, which is known as cancer. So it can lead to cell division or cancer. Mutation in KRAS leads to cancer. So what are these specific mutations? Remember, in KRAS protein, there are mainly three, although there are numerous mutations, but most of the mutation, they come under three groups: G12 mutation, G13 mutation, and some Q61 mutation. We don't have to remember the name of these mutation. So this RAS, when got mutated with this G12, G13, etc., it binds to cyclophilin A, and this leads to activation of pathway, which leads to cell division. So earlier we had a drug for pancreatic cancer, which is a RAS inhibitor. That initial drug was sotorasib. Now the problem with sotorasib was that it only targets G12 mutated form of RAS enzyme or RAS protein. But the new drug, Daraxonrasib, it can target and it can block the activity of RAS with any mutation. It can be G12, G13, Q61. So it targets pan G mutation. So can we say that a cancer is not a single a single, we can say that cancer is a very heterogeneous disease. Some people will have different mutation, some people will have different mutation. So sotorasib was only targeting one mutation, while daraxonrasib is a pan means every type of RAS inhibitor. And how it works, this daraxonrasib, it first goes and binds to cyclophilin A. It will make a dimer, and after binding to cyclophilin A, it acts to signal pathway, that is RAS and RAF pathway. Now the good thing about this daraxonrasib is that it only binds to RAS when the RAS is overactive or in on phase. So can we say in a cancerous cell, RAS will be in on state, it is overactive, so it will only target the cancerous cells. And when it binds to RAS pathway, it makes some tripartite complex, and this complex inhibits signal transduction, which we discuss. It blocks RAF signaling and PI3K signaling, which was responsible for cell division. Hence, it directly blocks the cell division in cancer. Now, the point is how we tested this drug. The name of the trial, that phase 3 trial, the last trial in which we find the efficacy of a drug, is phase 3 trial. So with this drug, the trial name was RASolute trial 302. So what happened in this trial? There were 500 patients of pancreatic cancers enrolled, and those mutated RAS mutated pancreatic ductal adenocarcinoma cancer patient, they were randomized into two groups. One group, they had given daraxonrasib, which is 300 milligram oral single dose daily, and other group was receiving the standard therapy which was available with chemotherapy like platinum compound, 5-fluorouracil, gemcitabine, etc. The standard chemotherapy. And after 6 months to 1 year, they check how much effect was there. So the end point was overall survival. That means after how many months the patient died, overall survival, and progression free survival, that after how many months the cancer again started growing. So these were the two primary endpoint. And to the magical results that were approved was, we can see this graph. So you can see this graph, there are two lines. It is Kaplan-Meier plot, which tells us about the survival analysis, that for how long patients survive. So we can see that in one line we are having chemotherapy, and the second one we are having is drug, our drug. And what we saw, that median overall survival was drastically improved. In chemotherapy patient usually survived till 6 months, while daraxonrasib group, the median survival was overall doubled. That means 100 times more increase. And it is in the history, the first time a cancerous drug has shown such a great result. So just imagine, 6 months have been increased. For us healthy people, it seems a very little improvement, but just think in the perspective of a cancer patient. A person is going to die in 6 months. Now this patient is living for another 6 to 7 months. That is 100% more survival. So it was a drastic and a very good result. And even when the conference was held, all the doctors, all the healthcare professionals, they gave a standing ovation when these results were there. And if you talk about the hazard ratio, that how much improvement was there, there was 60%. The gap is 60% reduction in death risk in the patient. And overall, there was control in death rates up to 90%. So again, such a wonderful drug. It's a major breakthrough in cancer chemotherapy now. And if you talk about the adverse effect or the harmful effect, it is much more safer as compared to the standard chemotherapy. The side effects were very mild, similar to rashes, stomatitis, a very non-specific side effect, that is nausea, diarrhea, and fatigue. And even the patient who were taking both therapy, chemotherapy and this drug, daraxonrasib, the tolerability was also very good. The discontinuation rate was just 1.2% versus 11.2% of chemotherapy. So in conclusion, This drug, Daraxonrasib, it is a paradigm shift from chemotherapy for the treatment of pancreatic cancer now to pan RAS targeting or RAS inhibition. And initially, this RAS was undruggable. We were not having any good drug for RAS mutated cancer. So, this new drug, Daraxonrasib, now has changed the face of the cancer treatment, especially in untreatable pancreatic cancer. So many new innovations are in pipeline. Let's see the humanity goes in the right direction. So I hope you enjoyed this lecture. Best wishes. Keep learning always.